Please help me in welcoming the former mayor of New York City, World Health Organization Global Ambassador for Non-Communicable Diseases, UN Special Envoy for Climate Action. But let's face it, Mike, most importantly, from our perspective, graduate and class president of the class of 1964 at Johns Hopkins University, Mike Bloomberg.
Thank you. Ron, thank you for those kind words. You gave them exactly the way I wrote them for you. But I did tell Ron before he started speaking, just remember, I haven't cut the check to the endowment yet. I also want to thank Ellen McKinsey, our talented dean of the School of Public Health at Johns Hopkins. You're doing an incredible job. Keep up the great work. And two people who are leading the Bloomberg American Health Initiative at Johns Hopkins, Josh Sharstein and Associate Director Michelle Spencer. And doing the hard work at Bloomberg Philanthropies, Dr. Kelly Henning. Thank you all. You are the ones who are in the trenches day in and day out doing all the hard work. And I don't think there's any more important job than saving and improving lives. I know you don't get the recognition you deserve always, but you really are heroes in my book, and I thank all of you. We all owe a great debt of gratitude. When we decided to create the Bloomberg American Health Initiative with Johns Hopkins 2 years ago, bringing people together like this was always part of our intention. All the challenges that you've discussed are critically important, and our foundation is glad to support the work that many of you are doing. And this morning, I would like to zero in on just one of the challenges, and that one is ripping at the hearts of so many families and communities across our country, and that is addiction. And I would like to begin by asking everyone to please take a moment to look down at their chair. This is everybody in the audience, and see what color your chair is. Okay, can you remember what color it is? Okay, now if you are sitting in a blue chair, please stand up. Take a look around. 130 people are standing. 130 is the estimated number of Americans who will die of an opioid overdose today. 130 more will die from opioids tomorrow, and the next day, and the next if nothing changes. Thank you, and please sit down. Now, if you're in a red chair, please stand up. Okay, if I count quickly, at least my notes say if I count quickly, 60 of you are standing. 60 is the number of Americans who have gotten a prescription for opioids in the 10 seconds since I just asked you to please stand. Do the math. 60 prescriptions in 10 seconds, which means 6 opioid prescriptions are written every single second in this country. And I did the math myself to make sure it's right. That adds up to more than 500,000 prescriptions every single day. Please sit down. Now, if you're in a black chair, please stand up. One person. This one person represents one child somewhere in America who was removed from his or her parents' care because of their opioid addiction since I began speaking. By the time I'm done speaking to you this morning, another child will be separated from his or her parents because of the dangers of opioid addiction. And by the end of the day, that number will reach 240. That's 240 children taken from their parents, 240 families broken apart in a single day. Thank you. You may sit. Opioid addiction, seriously, is a national crisis, and no community, as we know, is immune. There are 350 people in this auditorium, and I would bet that at least some of you have experienced the tragedy of this crisis in your own families. And unless we act now, the toll will grow heavier and heavier. More families and communities will be torn apart. More people will be released from hospitals after overdoses without receiving the medical treatment that they need. More people will languish in prisons without receiving the medical treatment they need. More people will die because medications that help cure addiction are stigmatized, and ones that can help people survive an overdose are in short supply. And more patients will become addicted to prescription opioids when there are other, safer options available. Our leaders in Washington have failed to meet the challenge with the urgency and bold solutions that are required, and we can't wait another day. We have to act right now. Now, this is a problem which touches every part of our society. So I believe, and I'm sure you agree, that every part of society has to be part of the solution. Doctors, teachers, researchers, fellows, police officers, parents. It will take all of them, and especially all of you, leaders in the public health field. I first became passionate about public health when I was serving on the board of Johns Hopkins more than 25 years ago. Al Summer, who is sitting right here, was dean of the public health school then, and he was the one that really sparked my curiosity. And the more I learned about the work going on there, the more I realized what an opportunity public health offers to save and improve lives. And I'm glad to say that Al serves on the board of our foundation today, and along with two other board members who make great contributions to our foundation, Tenley Albright and Walter Isaacson, who are both here today. Tenley, Walter, Al, thank you for your commitment on these issues, and thank you for your service over all of these years. We really can depend on you, and you're making a difference. Now, one of the ways our foundation considers what issues to take on is by looking at the leading causes of death and analyzing where we can make a significant difference. And that's why we've decided to lead the charge in tackling tobacco use, road safety, obesity, and other important challenges. And it's why today we are launching a major new effort to stop the opioid epidemic in America. The CDC's report on life expectancy this week underscores just how important this work is. Hard as it is to believe, in the United States of America, life expectancy has actually declined over the past 3 years. That hasn't happened since World War I, and we just cannot let it continue. As all of you know, opioids are a big part of the problem. Last year, fatal drug overdoses rose by 10%, and opioids are the main driver of that increase. And that's a big reason why we've convened this first ever conference and brought together so many leaders in the field. We know that smart policies improve and lengthen lives. In New York City, when I was mayor, we were able to extend life expectancy by more than 3 years over our 12 years in office. So we know that progress is possible. Sometimes the interventions are controversial at first, like our smoking ban was. I remember after putting in the smoking ban, nobody wanted to take a picture with me. But I did get an awful lot of one-finger waves and parades. But once people saw the benefits, they embraced it. And that's been true for so many public health policies. And now we want to take the same bold approach to fighting opioid addiction. The good news is we are starting to see some progress, thanks in part to the great work done by the people in this room. Just yesterday, a federal court in Massachusetts ordered a local jail to provide methadone to help an inmate kick addiction, a ruling that we hope will set a national precedent. But we can do more and act faster. And that's why today I'm glad to say that our foundation is launching a new effort to support the most promising work being done by state and local leaders to save lives and help it spread across the country. In total, we are making a new commitment of $50 million for this effort. And we're going to start with one state, the state that has been the hardest hit by this epidemic, Pennsylvania. The state's Governor Tom Wolf, who is with us today, has been a real leader on this issue. He's done a lot to bring people together and to expand access to life-saving treatment. And we'll work together to launch a comprehensive effort to tackle opioids from every angle. This will be a statewide, all-hands-on-deck effort to fight the opioid crisis on a scale that has never been attempted before. We'll work to reduce overprescriptions and improve access to treatment in jails, prisons, and hospitals. We'll improve access to drugs that can save lives in cases of overdose. We'll help with all the groups on the forefront of this epidemic collect and share data. And we will also work to identify innovative new ways to stop addiction and overdoses. That, we think, will create a blueprint that can spread from state to state across this country and start a new wave of change that can reach every corner of our nation. And to speed progress in that direction, we'll also begin working in 9 other states with high rates of opioid abuse. We're assembling a group of leaders in this field from Johns Hopkins, from CDC, from the Pew Charitable Trust, and from Vital Strategies, which is a close partner of our foundation on a number of issues. Together, we will encourage Washington to act more boldly by showing that progress is possible. Until the federal government begins tackling this issue with the urgency it requires, we will step in and support the states, give them the evidence that they need to take bold and decisive action on their own. I'm hopeful that we can achieve this working together. I'm hopeful because of people like Jody Rich, who directs the Center for Prisoner Health and Human Rights in Rhode Island, Sandra Danforth, a harm reduction services coordinator, Michael Fingerhood, an addiction medical doctor, Nicole Alexander Scott, the director of the Rhode Island Department of Health, Susan Sherman, a professor and researcher on opioids, Amanda Lattimore, a scientist and opioid crisis specialist, Peter Brune, a parent whose child was addicted, Kathy Stone, a certified high-performance coach, Anika Alfonso, a doctor and professor at Johns Hopkins, and Brandon Del Pozo, the police chief of Burlington, Vermont. I'm hopeful because so many people in so many walks of life are committed to fighting this epidemic. Their commitment is unwavering. To them, it's very personal.
My name is Dr. Jody Rich. I've spent my career caring for and advocating for patients who are marginalized and disadvantaged, including those with HIV, addiction, and incarceration. In Rhode Island, we expanded medications for addiction treatment in our prison and jail and documented a 61% drop in post-release overdose deaths. I'm eager and ready to do much more.
My name is Sarah Danforth. I'm proud to work for an organization that provides health empowerment services to injection drug users. I know that we can make a positive change with this opiate epidemic by including members from all communities and with a focus on the perspectives and leadership from people most affected, those who use drugs themselves.
I am Michael Fingerhood. As a clinician, educator, and researcher, I'm really excited to be working on ways to engage the community and create novel strategies to combat the opioid epidemic.
I am Susan Sherman. I'm a professor, researcher, and advocate. I'm excited to have meaningful conversations about the complex drivers of the opioid epidemic and how we all can respond in a way that focuses on programs that are evidence-based, grounded in harm reduction, and include the voices of people who use drugs.
I'm Dr. Nicole Alexander Scott. I believe that even one overdose is one too many. We need to come together as families, communities, states, and a country to give everyone with substance use disorder the resources and support they need. Everyone needs to know that change is possible, hope is possible, and recovery is never out of reach.
I'm Brandon Del Pozo, an American chief of police. My police department and its police officers are committed to helping Americans survive the trials of addiction. In order to do that, we're working hard to make sure that the people we come in contact with have the best access to the medicine and the treatment that they need and that they deserve. It's hard work, but our commitment is real, and we can't go it alone, and I'm grateful that we don't have to.
I'm Dr. Anika Alfonso, and I work at 2 comprehensive outpatient substance use disorder treatment programs in Baltimore. This issue is important to me because addiction is a treatable disease. We have effective treatments for opiate use disorder, and patients shouldn't have to die from lack of access to treatment.
I'm Kathy Stone, and I've had the privilege to be clean and sober from drugs and alcohol for 33 years. I have personally witnessed the opioid crisis in the lives of people I know and love. I am passionate about the powerful impact that coaching and training can achieve when focused on moving family members away from patterns of codependency to become their loved ones' best chance at recovery.
My name is Peter Brune, and the initiative I founded aims to challenge stigma and discrimination associated with mental illness and substance use. I do this work because I believe were opioid addiction less stigmatized, my daughter, Elisif, who died of an overdose on February 11th, 2014, would still be alive today.
My name is Amanda Lattimore. Because I was born to a mother who developed heroin addiction, I know firsthand how addiction can take hold of an individual and impact lives, families, communities. But I am so incredibly hopeful that if we all work together and we listen intently to both the evidence and the voices of people whose lives are affected every day, we can overcome the opioid crisis. In fact, I'm more than hopeful. I know we can do it together.
Thank you to this amazing group. Another round of applause for all of them. Now, I know we can turn the tide on this epidemic, and if we do, we can begin reversing the decline in life expectancy that has been happening across our country, largely thanks to the opioid overdoses. Here are some of the goals that I think we should all want to see reached in the next 5 years. All doctors will follow CDC guidelines on when to prescribe opioids. All insurers will provide coverage for alternatives like physical therapy. All Americans struggling with opioid addiction will have access to life-saving treatment and medications wherever they seek care. And that includes everyone with an opioid addiction who is serving time in prison and repaying their debt to society. And all of us will work to fight the stigma around addiction, which prevents people from getting the help they need. We have a lot of work ahead of us, so let's get to it. And I want to thank all of you for being part of this work and for all of you to help people live longer and better lives. It really is inspiring to see. All the best for a productive day. You really are doing a wonderful thing for America and the world. Thank you.